Hi, this is Chapter 14, Genetic and Genomic Testing. I'm Tracy Koch, one of your instructors for this class. Okay, so genetic and genomic testing. It's an overview of testing options and how they work. We're going to also touch on some ethical issues and some different kinds of genetic tests and talk about a few different genetic disorders in the process of talking about testing. Okay. What is genetic testing? Well, it's the analysis of DNA, RNA, chromosomes, proteins, and other protein metabolites in order to identify heritable variations in genes and/or chromosomes. So initially, these tests were done for clinical research. However, now that access has broadened and the tests are easier and more available, there's actually a direct-to-consumer testing market that's really opening up, and we'll touch on that later in this slideshow. There are over 2,000 disorders that can be tested for genetically, and what each test looks for is a little bit different. So there's some variation in what we're testing and how we're testing. Some of the tests will show variants that actually cause diseases, and some of the tests will show variants that actually are just associated with diseases. So a test might detect something in a person with a disorder, but we don't know whether or not there is that causal relationship. So it can be some muddied waters on some of these test results, which we'll touch on a little bit later as well. For up-to-date, accurate information, www.genetest.org, funded by the National Institutes of Health and administered by UW. It's a good resource for all your genetic testing questions. All right, so the samples for genetic testing can vary. Anything that you can extract DNA from or from any cell with a true nucleus is a candidate sample for genetic testing. Blood, cheek swabs, saliva, skin cells, hair follicles, tissues, biopsies, any of those things can be used in testing, genetic testing. Here's an overview of the types of genetic testing, and we'll go in depth on each one of these a little more. Diagnostic testing, where you actually test for diagnose the disease. Predictive testing, which can be pre-symptomatic or predispositional. Carrier testing and prenatal testing. So you can see there's a lot of different categories here when we talk about genetic testing. Here's a little chart that kind of explains each bullet. Diagnosing the disease, pinpointing genetic factors that cause your disease, predict how severe your disease might be, choose your best medicine, discover genetic factors that increase your disease risk, find genetic factors that could be passed to your children, and screening newborns. Okay, diagnostic testing. That's done to actually confirm the diagnosis or rule out a particular diagnosis in a symptomatic person. It can clarify your diagnosis. The clinical or biochemical tests actually might be called in to confirm the test, or it might be a better choice for some disorders. I'm thinking about cystic fibrosis, where we still use the sweat chloride test that really gives us an accurate diagnosis. It also can provide information about other family members. Predictive genetic testing is kind of broken up into two different categories. One is a pre-symptomatic test. So a positive result means that he or she will actually develop the disease. An exemplar of this is Huntington's disease. A predispositional test is when you have the gene variant that will increase the likelihood that a person will get the genetic disease. Such an example of this would be the BRCA1 and 2 alleles of breast cancer. Inconclusive results are neither positive nor negative. The person tested has a gene variant, but it has not been linked to the disease in question. So this is a really confusing result for patients to get, or clients to get. So this is where genetic test counseling really comes into play. On these folks, you do maintain your strict screening guidelines based on their family history. Carrier testing. Members of the family are affected by a heritable disease. However, the persons themselves are not affected. So this actually we see in high-risk based on ethnicity. It's often done for couples considering having children. An example of this would be Ashkenazi Jewish descent folks who are planning to have a family and want some genetic testing done. an Ashkenazi testing panel consists of these certain genetic disorders, and this is in your textbook too. So, carrier frequencies in selected genetic conditions. This is a chart that goes by diseases, populations, and the carrier frequency, and you can review this at your leisure. Prenatal testing. Prenatal testing is done to determine if a fetus carries a gene variant or has a chromosomal disorder. So it tests both the gene variant and the chromosomal disorder. Multiple marker screening, or the screening with the maternal serum alpha-fetoprotein, and it's definitely not a diagnostic test, it's more a screening test. This can be done via ultrasound, fetal-echocardiograph, MRI, fetoscopy, villi sampling, or amniocentesis. Pre-implantation genetic diagnoses are a little bit different. This is a little controversial, as you might imagine. This is done in conjunction with in vitro fertilization. The cells are removed from the blastocyst and tested for different gene variants. It can also test chromosome disorders and even sex determination. So with this kind of testing, the healthy embryos are kept and chosen for implantation. This is an expensive venture, definitely, for folks, and like I said before, it's controversial. Newborn screenings. Newborn screenings are the little heel sticks that newborns get right after birth and then 10 days to 2 weeks afterwards. This identifies infants at high risk of diseases for which immediate intervention is available. So the pressure is on to get these tests and look for these biochemical markers so that we can treat things like hypothyroidism and other disorders before they start to cause permanent damage to the newborn. They vary from state to state. Every state does the PKU testing, and most states do hypothyroid and galactosemia and sickle cell. And in Idaho, we also have a cystic fibrosis test on the newborn screen as well. Other types of genetic testing, zygosity testing, I think that's how you say that. It determines if twins are identical or fraternal. And of course, parentage testing or paternity testing, which will look for biological family relationships, testing paternity. It used to be really difficult and expensive, and now it is pretty available and easy to obtain. All right, so the types of genetic testing, interpretation, and follow-up. When you have a positive test result and a diagnostic test, this is when you have a clinical diagnosis confirmed. Your follow-up includes genetic counseling and some medical management and treatment. For a positive test in a predictive testing situation, the interpretation is that the likelihood of showing disease symptoms is increased. So you also need genetic counseling, planning for medical management, etc. Carrier testing will reveal if the patient is a carrier, and testing for a partner or prenatal test might be indicated. For prenatal testing, the fetus would be diagnosed with a specific condition, or a specific condition would be identified, and then the pregnancy treatment and management would be included in the follow-up. For newborn screening, disease in a newborn is suggested, so confirmatory testing would have to take place after that. This chart is for negative test results and what your follow-up might be. So a diagnostic test that is negative, there might be some clinical symptoms that are still unexplained, so you might have to do some further digging. Predictive testing, the likelihood of showing symptoms would be decreased, so you would have to do some counseling to that person, more about maybe some survivor guilt or long-range planning, but no high-risk surveillance would be needed at that point. Carrier testing, if it's negative, you might offer that testing to other family members if it's indicated. Prenatal testing, if the fetus is still symptomatic, so maybe by an ultrasound you see something unusual, but the genetic test that you do via amniocentesis is negative. You would have to do some further management and some further testing. Newborn screening, if the newborn is not expected to have the condition that they're tested for, there really is no follow-up. Oversight of genetic testing is done by CLIA. They manage and set forth some regulations so that there's some accuracy and the clinical usefulness of the tests are identified. This is becoming more and more important with the direct-to-consumer testing. The Department of Health and Human Services also will work to have some oversight of those laboratories doing the testing. DNA sequencing. So this is a kind of test. And in DNA sequencing, this is used polymerase chain reaction, can hardly say that word, a PCR. So I think any of you that have worked in the healthcare field or with laboratories are familiar with the term PCR. Pertussis screens are done with a PCR kind of test. So you look for possible sites of the regulatory genes, and an electropherogram is the graphing or the laying out of this test that you do. It's a graphic illustration of the amplified DNA that you've looked at. This is an example of that electropherogram, and you can see that it's comparing the sequence that you tested to the common sequence. And this just graphs it out for you. Cytogenic testing is when you evaluate the entire chromosome for any kind of variation in the structure or the number. Used for infertility and cancer tumor cells, and prenatal screen for possible Down syndrome. This is an example of the cytogenic chromosome study. That's in your textbook too. Fluorescent in situ hybridization, abbreviated FISH. This is, excuse me, a string of bases from a section of a chromosome. They're given a specific dye, or a specific dye is put on these, and there's a glow with the material. Okay, so sorry about that coughing attack there. Getting back to the FISH type of test. So this maps the genetic material, so you get a visual of the genes or the genetic material, and this is often used on breast biopsies. So you can look at the translocation, deletions, microdeletions, and all sorts of abnormalities that you might detect on the chain of the chromosome. Okay, let's see here. What do we got next? Genome-wide association studies are when you compare genomes. So these are large aggregates, and looking at markers or SNPs, comparing a genome of a large number of the affected folks as well as a large number of unaffected people. So we use these in studying genetic variations that are maybe contribute to complex diseases like diabetes type 2, heart disease, obesity, Parkinson's. That's where these tests are most useful. Okay, moving into direct-to-consumer genetic testing. These are tests that maybe are available over the internet, and if you're interested, there's some statements from professional organizations, and it kind of just gives their opinions, I guess you would say, or their statements related to direct-to-consumer genetic testing. There's a lot of concerns with this. You know, lack of informed consent. You wonder about the person involved ordering the test, how knowledgeable they are, how much they know, what kind of counseling is going on, whether the tests are appropriate, maybe the results are misinterpreted, inaccurate tests, invalid tests, in you know, the lack of follow-up care. So if someone tests positive for a disorder and maybe they need some medical attention and that isn't addressed without someone doing the pre and post test counseling. Also protection of consumer privacy. So when I think about direct-to-consumer genetic testing, it's, you know, on there's advertisements for Ancestry.com, and you can check your genetic or your ethnic background through a DNA test, which is, you know, it's interesting. But the other test that I have been seeing advertised is Cologuard, which is the new colon cancer test that people take home with them and then send in. On that website, though, it looks like you do need a medical provider to order the test. So you can't just go out and purchase it yourself, it looks like. And the test results that I was reading on their site is 92% sensitivity and 87% specificity. So, I don't know how accurate, but it's their website, so, but again, I don't know how widespread use this is having, or I think as time will tell whether or not this test is useful in helping to identify genetic markers for colon cancer. Okay, so the risks and benefits of genetic testing. Certainly you can have better adherence to monitoring guidelines. So folks that, may need some preparation for the future, looking ahead, and if the likelihood of becoming ill is high, they can plan for the future, reducing uncertainty, and of course the importance of counseling by a genetics professional. That can't be really replaced, in my opinion. Okay, so that kind of concludes our PowerPoint, and there are some other exercises on the Blackboard webpage. Thanks for listening.